Very good evening and welcome all.
Good
Welcome
evening,
all.
sir.
Good
Smriti
evening.
members.
Good evening.
Sir.
Good evening, sir.
I'm very happy to see you again this very good evening. So today we are gathering here just mainly to release the standard operating procedure which we prepared and we already introduced to you, and we would like to make it more familiarized. For that only we are gathering here. So of course, Smriti practice started very long back, and initially we were teaching orally, and there were not much materials to provide. Then we have introduced a Smriti meditation book in which we have included all the procedures in detail. But as we go on, now recently we have finished 32nd batch in India, and there are many other courses we conducted abroad also. So many questions were raised during our courses. So we are trying to answer all of them, but it is very much essential to make it as a proper document so that everybody can refer at any point of time, and that should be the Bible for Smriti meditation practice. But I should say that that is not going to be the final version. It will be go on modifying because we are getting a lot of experience from our students. Also, we are getting many feedbacks. From that, we are making many modifications. So, but at this point of time, this is the basis. From that, we can further conduct many researches. Of course, there are certain researches are also going on. So from that findings also, we have to modify some of our observations and practices also. So today, we are very happy to welcome Dr. M.V. Vinod Kumar to release the standard operating procedure. Dr. M.V. Vinod Kumar is a professor in VPSV Ayurveda College, Kottakkal, and he is a well-wisher and always guiding our institute and team. And now he is in Vadodara for some other activities. He is joining with us. Welcome, Dr. Vinod Kumar, sir.
Namaste, sir. Namaste. Namaste, sir. Good evening.
Good evening.
Namaste. Namaste. Yes.
So also today we would like to make it more familiar, all this SOP once again with the detailing of each and every points, which we already done in one of our Smriti Sangamam, which we conducted last year in August 2025. But today, Dr. Mohammed Safir will be explaining in detail once again, and also we can clear many of our doubts that also. And I would like to tell that I am very glad to congratulate and thank Dr. Mohammed Safir and Dr. Shamna. They have prepared this document for us. And also I would like to invite the latest batch, that is the 32nd batch, which that course was in English. That's why today we will be having this conversation in English because of for them. And also Dr. Martina Siska was insisting for a long time to make it in English because she was not able to attend many times. But today we are having this conversation in English. And welcome each one of you once again. And let me cordially invite Dr. M.V. Vinod Kumar to release this SOP and say a few words for us.
Namaste, sir. Namaste. Whoever is gathered here. especially from different parts of the world. And very happy to see some of my dearest friends here, and especially Dilip sir, Safir is there, and I can see Dr. Nisha there, Dr. Aparna, many people whom we had collaboration in the some of the activities related to counseling and all. So that makes me very happy. And I think this is a milestone in the history of psychotherapy. I think I consider this as a milestone because we have many type of activities going on around the world. There are many types of activities going on psychotherapy. And one such activity from the part of Ayurveda is marked as Smriti meditation. And by the dedicated inputs of Dilip sir and the team from Smriti Meditation, Smriti Institute, that concept of Smriti meditation has elaborated. That means it became a very extensive type of discourse. While it was sprouted at Kottakkal in the mind of Dilip sir, and the practice when it sprouted out as Smriti meditation and the practice what is encoded in this SOP, I can see from outside. I can see that elaboration, that kind of an means extended activity in that document itself. So I consider that there are many cases going on in the field of psychotherapy, because whenever you entrust psychotherapy with modern psychology, there are many emerging problems there. One among them is how to address the existential problems of human mankind. That is, what is the purposefulness of life? Those things, existential issues in human mind. Most of the people apart from this Smriti meditation, especially from the part of modern psychology, they are defining those things in different ways. I can consider it as a fragmented way, because they have their own methodology which are not integrated together. But in our case, as in the case of Tridosha in human physiology, and the case of Jnana in the case of psychotherapy, we can integrate many things together. Okay, almost all the aspects of psychology can be integrated together to become a base model, and we can elaborate this base model into different types of practices. That is what I understand. That is what happens in the case of Smriti meditation. So this document is going to become a landmark in the practice. Already it is in practice, but it is getting documented. That is the most important thing. As Dilip sir had done two wonderful works related to Smriti meditation previously as the study material as in the form of books. Now it comes in the form of standard operating procedures. So that means Smriti meditation is going beyond a mere intuitional type of an activity, but it becomes more structured, scientific, and what you can call it as it's something like a parametric approach. Means you are going with a parameter, and with some visible outcomes are there. You can assess those things. You can standardize your practice. All those things happen due to the development of this SOP. So I consider it as a very important milestone, not only in the case of Smriti meditation, but also in the larger perspective of psychotherapy. It is a milestone. So in that sense, I am very much happy to release this. Dilip sir is my guru. So I consider it as one of the most important, significant contribution from the part of Dilip sir and the team to the field of psychotherapy as a whole. So I humbly declare this SOP released in this August occasion. And thank you, Dilip sir, for permitting me, for inviting me for this occasion. And thank you all others. And we will have some more collaborations in the future also. I was a part of when Dilip sir started studying Jnana, a humble effort we could incorporate from my part. From in my department, we have done as research in that part, and conceptual elaboration of jnana. And I am very much happy that those efforts are getting fruitful in developing this type of things by Dilip sir. I am happy to see that also. Thank you, sir. Thank you once again for inviting me and meeting all my friends here. Thank you. Thank you, sir.
Samyuta.
Thank you, Dr. Vinod Kumar, for that wonderful words. And hope we will be further collaborating to understand to the depth of Jnana, Vijnana, Dhairya, Smriti, Samadhi, which is very, very important for the Ayurvedic community. And Dr. Vinod Kumar initiated one such study. One of his disciple, Dr. Gayatri, has studied on Jnana and submitted a thesis on that. And now we are planning some more collaborative research on this. I hope that will help us to understand more depth of our traditional knowledge. Okay, thank you, sir, once again. Okay, now let's move on to next session. So the Dr. Mohammed Safir will be talking about this details of the SOP, make to more familiarizing the aspects of the SOP. I welcome Dr. Mohammed Safir for that. As you all know that I need not introduce him because he is very, very familiar to you all. He is administrative officer of Smriti Institute, and he is everything about. So I need not say many words about him. Welcome, Dr. Mohammed Safir.
Thank you, sir. Good evening, all. And I'm so happy to meet you all again. And I'm very inspired and proud after hearing Vinod sir's remarks about the SOP. And obviously, it's a proud moment. And in the journey of Smriti Meditation Institute, Dilip sir was always having some companions like Vinod sir, Jayadev sir, Prakash Mangaleshwari sir, and all those team from the very beginning. And this journey is actually indebted to all those persons also. And I would like to introduce the SOP. Actually, the SOP is a very elaborate document, and I want to just familiarize those things within a very stipulated time. So I'll be just mentioning all those things, and I hope you can have some questions after after what I present, and sir will be answering to those queries. Let me share the SOP. So, Smriti Ayurveda Meditation Therapy Standard Operative Procedure, a comprehensive clinical and administrative framework for Smriti-based psychotherapeutic practice. So here, clinical as well as administrative framework is included, and we will see one by one what all of the things included. This is a preface. Coming to the contents. First one is core principle. Here, the purpose and scope is explained. Next is the prerequisite. It's very important how to set up a Smriti meditation clinic. And Now the administrative procedures in Smriti Ayurveda meditation therapy, from the client intake till the uh, till winding up the session, all the aspects are explained here. Then qualification and competencies required of the guiding doctor in SMT, Smriti meditation therapy. Then the Smriti Ayurveda meditation therapy procedure SOP. The last fifth portion is the elaborate description. Already we discussed in the classes like CSM basic courses and advanced courses. Once again, we will refresh those portions. And conclusion. After that, some three specific appendices are added, like patient information sheet is there, consent form is there, and a preliminary screening and registration form is there. Okay. Now let's go through each and every part of this SOP. Now, at first I told, first part is the core principle. So what purpose we are introducing the SOP means the first and foremost thing is that to make sure that all the Smriti meditation practitioners should practice a standard form of Smriti meditation. Sir already told, already 32 batches are completed. So from the first batch till the 32nd batch, a lot of things are being added. After from your part also, we are getting many information while conducting class. We are getting more and more insight. We are making the content more and more elaborate, and all these things are added. Whatever things we introduced till date are included in the SOP. So it's a material to practice for every practitioner. The uniform pattern should be maintained. That is the first core principle what this SOP is intended. Now coming to the prerequisite. First thing is the therapy environmental and physical setup. First thing is like I'll just go through those things. You can read it from the SOP in detail. First is therapy environment and physical setup. Where should the clinic should be set up? Like how should be it set up? The location, soundproofing, seating arrangement, privacy and visibility, lighting, temperature control. All these things are the basic structural aspects while we are planning to set up a Smriti's meditation clinic. Okay. And these all things are very important. Location is very important since if it is in a very busy, noisy town and all, it will be very uncomfortable to the patient to complete the session. Otherwise, we should go for soundproofing. Soundproofing is very important so that external distraction should be minimized. And the seating arrangement and all, like the recliner chairs or semi-sleeper couches should be introduced. Then privacy and visibility. This part is very important because the we are conducting the session for 1.5 to 2 hours, and the bystander will be always very doubtful and very scared sometimes if the person is having some psychiatric issues and all, what the client and the doctor is doing inside. There will be a lot of confusion. So the visibility to the meditative room is very important, and along with the visibility, we should make sure the privacy also. The client should feel that privacy to share the client's personal emotional issues. And lighting is also very important, and that soft dim light, like it should be arranged like that. Then temperature control is important. Gender sensitivity. Maybe the client will be preferring therapists from the opposite gender. If the client has such preferences, we should accept and do the things accordingly. Then time management. Uh, then the next, these are the initial steps included in the prerequisites. Then the next part is documentation before the therapy. Before the therapy itself, we could complete the we could share the patient information sheet. Then consent form should be collected, and we should prepare the case sheet before starting the session. We should make sure that the case sheet is ready. Case record form is ready. Then coming to the ethical and professional readiness, it is about the preparedness of the practitioner, both in ethical aspects as well as the professional aspects. What all the things should be done from the expected from the practitioner side. Now, the next part is very important. While starting the clinic, is very people will be having a lot of confusion about how we can start the booking, how we can how is the client intake process, how can we give proper responses to the client, how professionally it should be handled, how the details regarding the fee structure should be conveyed to the client. A lot of administrative confusions will be there. So the first part is client intake process, how the client intake is done. Like under this head, we can see the initial inquiry and appointment. The client may be contacting us through WhatsApp, email, or direct walk-in, or whatever means, direct phone, or so. How this should be attended? Who is attending the call? So most often, the administrative front office staff will be handling the calls. So how we should educate that office staff. All these things are coming under this heading. Then the preliminary screening. Before starting the session itself, we can have a preliminary screening. At the end of this document, there is one appendix is given. It gives certain clues about the screening process. Next is the registration and case file creation. A case file is not only a single case sheet. Along with that, the patient information sheet should be that consent, the signed consent form, and the patient information sheet should be the case record form will be the then session summary sheets or for each therapy session. Maybe there will be 3 to 5 sessions for a single client. So along with the single case sheet, additional sheet should be added for documenting the details of each session. The notes on communication, follow-ups, and feedback. It is better to have a proper documentation to make sure that sometimes if we are not documenting the appointments or the follow-ups and all, at times maybe two patients may come at a time. So we should have a proper communication. Okay, we have clearly sent this message that your time is from this time to this time on this day. Like we should document all those things. Then assignment of doctor, we already discussed like gender specificity and all. If we have a panel of doctors, the client has the right to choose whichever patient, whichever doctor should serve the client. Then record keeping. Record keeping is very important because this is a medical evidence. Maybe especially in case of like medical legal cases and all, we should have proper documentation. So case record maintenance, we should have a clear policy. Then at least for a 5 years period, the case document should be archived like that. Then progress documentation. After each session, already I told, additional sheets are added, and the whatever progress happened in the after progress has noticed after the first session should be documented while the person is attending for the second session. So, like in consecutive sessions, whatever changes are happening as a result of the therapy procedure should be clearly documented. Then confidentiality and data protection is very important. The confidential details of the client should not be shared else anywhere. Like it's very important. Then outcome evaluation report. After that, while completing the sessions or while taking the break and all, we should have the clarity about what all of the changes happened. And archival policy, already I told, at least for 5 years, we have to document the case sheet. We have to preserve the case sheet. Then scheduling and time management. Session duration, mostly it will be at average 2 hour session. The time should be specified. Then number of session, how usually we will say that 3 to 5 sessions should be needed. Like number of sessions should be initially communicated with the client. Then session spacing and flexibility. After the first session, the second session should be conducted within 2 to 3 days, and the subsequent sessions are planned accordingly. Like all sessions should be completed within the time span of 1 month, or else if the doctor feels that there should be one gap between the successive sessions, so we can have a 1 or 2 weeks gap between the session. And in a session, if the doctor feels that the process is half the way, then we can have the follow-up session immediately after the after this session. Like the doctor can fix the timing between the consecutive sessions. Then and how many sessions means, we generally we will say 3 to 5 sessions. And in certain cases, like if the symptoms is very psychosis, where the patient is not having the proper insight and all, where delusions, hallucinations and all are associated, in certain cases it will take more time, and we have to communicate to the client accordingly. And the long term benefits, and we don't want to say like that, yeah, you can absolutely stop the session and no more session is needed at any time. Like the statements are not good. The client can take as much as sessions, because what we are practicing is sattva vijaya chikitsa. So elevation of sattva is not having a limitation. To what extent the person is having that desire to raise his sattva, elevate his sattva, we can support the client. We should not, we don't want to have that that kind of disappointment or disagreement when the client is asking that, yeah, I need more and more session. Then appoints confirmation and punctuality. This is very important. I already told, if the client, the proper communication should be there, proper like reminders should be sent to the client at least 24 hour. A final reminder should be sent. If we are attending the case through online, the meeting link should be provided earlier. If the process is through any online web platform and all, the password, login details, or whatever things, it should be shared prior to the session. Okay. Then emergency or walk-in session. Usually, if the practitioner is having a flow of clients, already the booking will be completed for 3 to 4 days. So if it is like that, and in between a client comes and you feel that the person's situation is very emergency, we should support the client at the earliest, then we can have some arrangements to include that session, maybe like postponing a follow-up session or like that. So we can have, we should have proper communication with the client whose session is being postponed, and we should educate the client who came for a walk-in session, like the process of booking and all is like that. You should take previous appointment and all if you are wishing to continue the session. That like that proper communication should be done. So the communication and follow-up coordination is very important after each session. The ideal way to practice and to make sure that follow-ups are getting is that after completing the session, we can give the we can give the uh, next appointment details. Like yeah, you can have the next sitting on today is 12th. So if we are completing one session today, we can give yeah your second session will be on 15th morning 8 a.m. So we can lock that particular slot. And when another person is coming, it's very clear that 15th morning 8 a.m. slot is already occupied. Okay, like we can give a very clear communication with the client and follow-up reminders should be sent. Okay. And some more practical thing is like while taking the appointment itself, if we are advancing some booking charges, it will be very nice to make sure that there will be no cancellation. Okay. So either partially or full payment can be done before starting the session, before giving the meeting link for if it is online session, and even if it is a offline session, it's better to take a advance booking amount to make sure that there will not be uninformed cancellation from the client side. Okay. Then next part is qualification and competencies required to the guiding doctor in SMT. So already we all are Smriti basic or advanced course completed doctors. Along with that, we should experience meditation, because regular self meditation or meditation under another guide is important, so that we should have the clarity whatever the emotional feelings or physical feelings or whatever images are coming to our mind, we should have a clarity about the client's perspective while he is saying that yeah, I'm feeling this and this kind of emotions. Before that, the doctor should have an experience about whatever experiences he is getting while practicing a meditation. So experience in meditation, then empathy and emotional attunement. Already you have all these things, all these qualities while since you all are Smriti practitioners. Then inner harmony and emotional stability is very important. Then respect for the individual self. This part is very important because the ultimate problem solver is the client itself. The client is solving his or her own problems. We are just guiding the person. So we should always respect the individual self. Then listening skill. Already these things are discussed while taking the basic classes and all. You can go through these document later in detail. Listening skills, then observation skills. Observation skills like we should have a very precise observing skill in both in verbal and non-verbal communication, like muscle tension, body postures and movements, breathing patterns, eye and lip movements, facial micro expressions, changes in the complexion of skin. So in certain cases, like if the person is feeling that severe emotional feels like anger and all, maybe the face will be that erythema, reddish, that color changes will be there in on the face. Like we should have a clear observation pattern about all these aspects. And while asking the questions in between the guiding process or while interacting with the client in between, we should have a very clear idea about the stages of the swapna or sushupti through the client is going through. How we are getting that the clarity? It is through the expressions only. While observing the eye movements, like fast moving eye movements are the process of visualization is very active. If the person is taking a deep breath means the person is settling some emotions and it's the right time to ask the question. So we should have a very clear observation from the very beginning of the session till the end, and we should not distract to our attention to our mobile phone or something like something there in our room. So if we are distracting ourselves means we will uh, feel disconnected with the client. We should have a connection with the client and we should go along with the swapna what the person is going through. Then only it will give a good result. Okay, then power of observation. The knowledge of Ayurvedic psychotherapy. Obviously, the theoretical part, we should have a clear idea about what all of the things, jnana, vijnana, dhairya, smriti, samadhi, what all of these things are meant about. We should have a very clear about idea. Then the knowledge of health and diseases. In certain cases, like today I had one case. The person is already a survivor of a stroke, and the person is strongly believing that the next attack happening to the person will be in the form of a epilepsy. Epilepsy. The person is saying that, oh, I will get fits in coming days, and I will be died soon. Like so, when I asked why you are making such statement, then she told like my mother had a history of stroke, and after 14 years of recovery, she was fine, and later she had a kind of fits happened to my mom, and it actually it was very devastating, and it ended up the termination of her life, like the patient client stated. Actually, the client was having a strong misbelief that every person who had a history of stroke will end up in epilepsy, and the death will be happening because of the epilepsy. So in such cases, we should have a proper medical knowledge and we should educate the patient. So the stroke is something like what is happening in the stroke, the type of like ischemic stroke, or what kind of stroke the person had. So what is happening while the ischemia is happening, and how it is resolved. What is the epilepsy basically? How the electric signals are being altered while epilepsy. So we should educate the person in that context. So before that, we should have a clear knowledge about the medical health condition. So being a doctor is the highest advantage while practicing psychotherapy, that we have a very clear cut idea about the symptoms and the confusions the client has. And in cases like particularly some psychosomatic conditions, uh, we will get a clear idea about what this disease is and what all are the emotional aspects related to with condition these and these conditions. So like the person is having strong emotional conflict, or like anger or sadness, or the fear, acne will be affected. If acne is being affected, what will be the subsequent changes? Where is the impact is happening? Like if it is like the dosha visheshan is happening in the amashaya, the symptoms will be like something like amashaya gadavada or something like that. If it is happening in pakvashaya, the symptoms will be something like pakvashaya gadavada or like that. If it is in the like exactly in the agni ashaya, the symptoms will be like burning gastritis or something like that. So we should have a clear cut idea about the medical science also, and the emotional feelings varies accordingly. If it is in pakvashaya, the dosha associated will be more predominantly a kind of fear. If it is the symptoms is in Agnyashaya, the emotional aspect behind these things will be more of kind of anger. And if it is a site is somewhere near the chest, it will be like recurrent respiratory tract infections and all. The predominant emotion will be something like sadness. So we will get a clue about what emotion the person is having while assessing the kind of symptoms the patient exhibits. So we should have a very clear idea about the basic Ayurvedic Nidana, Samprapti, and the manifestation of diseases and all. Then coming to this is the most important part, Smriti Ayurveda meditation therapy procedure SOP. First thing is a warm welcome. The client is coming to our consultation chamber. Then active listening and empathy. Then trust and confidentiality is very important. Once the trust is established, even the person is wishing to hide something from us. So the person will be feeling that, never, I won't open up these and these files. Like the person will be coming to your clinic, or the person will be coming to your clinic because of the pressure from parents or pressure from the partners or something like that. And the person will be very reluctant to open up. But if you get a proper trust between the client and you, automatically the client will open up and the client will start sharing whatever hidden things he knows. Okay, so it is very important. And in meditation also, the client is having a choice. Client will be seeing, like, for example, if the person is having a childhood trauma or something like, and the person is seeing the visuals, the person can forcefully hide those things. So if and only if the person, the client is having a good trust with the doctor, then only the client will start sharing that, yeah, now I am visualizing these and these things. Or else the person will be hiding or manipulating like that. So then use open-ended questions. Open-ended questions, it's like single or closed-end question means there will be at least one or two yes or no, one or two. Like minimal options will be there. But in open-ended questions, there will be a lot of options. For example, while introducing the client, to get the Vidya part elaborately, we can ask the client like, yeah, like if the client's name is like Anjana, we can ask, hello Anjana, just introduce yourself. So it's her choice to introduce herself, and she can introduce whatever aspects she wish to introduce. If we are not getting sufficient information, so if like family details are missing, then she can ask, we can ask like, Anjana, can you please explain about the details of your family? Again, it is an open-ended questions. So she can state that, yeah, I had my papa, mama, I have three siblings, I am the younger, me and the elder sister is having 5-year gap. Like she can elaborately describe about the details of her family. So always make sure that the question should be mostly the question should be open-ended. But in case of deeper Smriti meditation practice, like while the person is in Swapna, Sushupti and certain stages, we can give options. Either you are getting, so if the person is saying that I am feeling so uncomfortable feel in my chest, then we can ask either the uncomfortable feel is like heaviness, or some pain is there, or it is like some suffocating feel, or it is something is a tied up feel, or some like we can ask more and more options. Then the person will be it will be easier to pick one option from the given options. So we can have certain we can practice like that while we are entering to the deeper sessions, deeper status of Swapna, Sushupti, etc. Then Ongoing rapport maintenance means rapport is not a one-time step. From the beginning of the session till winding up, the rapport should be a healthy rapport should be there. If the rapport is broken, it's like the trust is broken, the person will not be able to navigate further. Then coming to the Smriti Ayurveda meditation therapy can be divided into two parts. First part is Ayurveda counseling therapy or ACT. Ayurveda counseling therapy is here we include Jnana, Vijnana, Dhairya. Jnana, Vijnana. Dhairya is the bridging part. Jnana and Vijnana are the two things included in the ACT, and bridged by Dhairya, we enter to the Smriti meditation therapy. So ACT includes Jnana and Vijnana. We'll go through the details of Jnana and Vijnana. For that, ACT flowchart is given. You can see the flowchart here. This is a ACT flowchart. See, here the first part is rapport building. A client doctor meeting happens, rapport building starts, and you can see in left side there is Jnana, in right side Vijnana. It's designed like that. The first step is when the after having a good rapport, we will go to the Vidya part. In Vidya, we will ask the client, okay, the self-introduction and stating the problem. This is included in the Vidya part. And coming to the Siddhi. Siddhi is like emotions, thoughts, physical ailments, behavioral problems, relationship issues. All these things are included in Siddhi. So Vidya is the first part, like the personal introduction, self-introduction, and the basic things like whatever the disease diagnosed earlier, the medical reports he or she is having, all these things are considered in Vidya. And Siddhi is the way how the problem is affecting the person. So physically, how it is affected, how it is affecting the client's emotions, thoughts, how the behavioral pattern and the daily routine activities and all are changed, how the person's relationship is affected because of this problem. It is included in Siddhi. So after the stating Siddhi, next thing is that primary goal setting. So after stating the Siddhi, we can ask the client like, okay, already you stated these problems and how the problems are affecting you. Now, what change do you want to have within you so that your life will be happy, healthy, and comfortable? So we can ask the primary goal at this point. Then the person will be stating that, yeah, I want to change my routine, like these habits and all. Like that, the person will be stating some first goal. So based on this goal, we will go to the Madi part. Madi means we will ask the clients, okay, now you can just elaborate the problem from where it started, how it has progressed, and how it is affecting you, and what is the right now present condition. So narration of story, multidimensional analysis, problem solving choices, all these things are included in Madi. Is it clear? Then after Madi, we will go to the Medha part. Medha parts mean the deeply seated things, the conditions, things and all comes under the Medha. Delusions, hallucination, core beliefs, Shiva, obsessions, phobia. All these deep-rooted things are there in the Medha. And the final thing is Prajna. Prajna is a judgment, insight, realization, or solution. After doing Vidya, Siddhi, Madi, and Medha, the client will be having some clarity about his or her problem. That thing is included in Prajna. So after Prajna, once again, we will ask the client to state the goal. It is the restated goal. It is a final goal. Okay. So initially, the client doctor meeting, rapport building, Vidya is done. Vidya is very superficial. There is no something like deep conscious or nothing is there. Whatever things are there in the surface memory, the patient can directly discuss with the guide. Vidya, then Siddhi means some more deeper, like it's some related with the musculoskeletal and all. Like Siddhi, physical ailments means related to musculoskeletal. Or it the things emotions. Emotion means deeply what we say in like deep in our brain like amygdala or certain specific points where the emotional aspects are included. It's some more deeper emotional aspects. Thoughts also, what the thoughts are processing in our brain, physical ailment, behavioral problems. Behaviors are formed as a result of conditioning. So what all of the behavioral patterns happening, then the relationship issues, all these things comes under Siddhi. Then primary goal is stated. Then Madhi is some more in-depth, elaborate analysis of whatever problem stated. Then we will be having a clarity about after stating the Siddhi, which part is affected. Either it is physical ailment, either it is emotional aspect, either whether it is related to thought, whether it is related to behavioral problem, or whether it is related to relationship issue. We have a clarity while stating the Siddhi, and we will be elaborating that part in the Madhi. Then Medha is the deeply conscious things what we want to elaborate. Then the Prajna, then restate the goal. These steps are included in the ACT. So Jnana and Vijnana. These things are uh, jointly done under the ACT process. Okay. Here the detailed notes are given. Then the next thing is how we can conduct ACT. Already the Jnana, Vijnana, all these things are explained. Okay, fine. How we will interrogate with the client. This is the next challenging thing. So for that, we formed an ACT questionnaire. Okay. So already Vinod Kumar sir explained about the Jnana. One study was conducted in as a part of PG research activity in Kottakkal Ayurveda College. It was related with the Jnana. So we have a specific questionnaire how we can do the ACT. So we will see the questionnaire. There is two levels are there. The first thing is ACT screening questionnaire, and the second part is ACT in-depth questionnaire. We'll see. This is a ACT screening questionnaire. Vidya. Usually, what we ask like, please introduce yourself, provide the details of any previous diagnosis, test, or assessment like that. Siddhi, how it is affecting your physical, mental health, how it is affecting your behaviors, how it is affecting your relationship. These questions are included in Siddhi. Then primary goal setting. Yeah. What specific changes do you believe would help you achieve greater happiness and improved health? This is the primary goal setting. Then coming to Madhi, describe in detail the problems you are experiencing from the starting of the session. That narration is included in Madhi. Then can you recall and describe a particular situation or incident when these problems were evident? Like we can elaborate the Madhi part. These all are the part of screening questionnaire. Then how do you anticipate these problems may affect you in the future? These are the questions in Madhi. Coming to Medha, explain your current understanding, perspective, and underlying beliefs regarding your issue. Then coming to Prajna, what new realization or insight you have gained about the issues during our discussion. The importance of ACT screening is that we will get an idea about where the problem exists. Earlier, I mentioned about one case. The person was having a wrong understanding about the kind of stroke and epilepsy. So we want to educate the patient. So the problem is lying in Vidya. Okay. So, we want to screen the person at first, and we should have a clarity at which level the problem exists. If it is in the level of Siddhi, especially at which aspect the problem is there, we want to elaborate those things. See, the in-depth questionnaire is given because of the um, time limitation. I am not deeply explaining all these things. See the Vidya, what all are the in-depth questions can be asked. He's given here. It's like checking his memories and all, and it's kind of mini mental stats examination. Like things are also included in Vidya part. That cognitive correction is the cognitive correction through medical advice or referral to expert is given at the level of Vidya. Then to Siddhi, the physical symptom. So if the person is stating like physical symptom, we should explore the kinesthetic awareness. If the person is stating about the headache, we want to elaborate the kind of headache, the detailed characteristics of the headache or whatever physical symptom the person is complaining about. Then thoughts. The more the awareness about the thought should be expanded. And the emotions, emotional awareness expansion, behavioral observation. And here you can see clinician guidelines. So clinician guidance, like while asking the questions, what all are the things we wanted to keep in mind while asking the question. These are included under the clinician guidance. Then collaborative footnote, like both the doctor and client, how the problem should be addressed. It is given in the collaborative footnote. Then coming to Madi, here also narration of story based on the summary of your experience. Here a lot of things are explained in which aspect the problem exists. Based on that, Madi, how Madi is elaborated, like narration of story. Uh, if so many things are being discussed, we want to prioritize which area should be given more emphasis. Then problem analysis, the capacity to identify root cause, then predictive knowledge. Then here also you can see the clinician guidance, what all are the things you should keep in mind while asking the detailed elaborative questions. Then coming to Metha, here also detailed questions are given uh, about the strong misbeliefs and the client's experiences, about the deeply hidden thoughts and all, and about his attitudes, beliefs, behaviors. We can ask these questions. Here also clinician guidance, collaborative footnote, all these things are given. Then coming to Prajna also, how we can elaborate the problem. If the problem exists in Prajna, we want to elaborate what all are the things happening in Prajna. Then after Prajna, the next step is here Vidya, Siddhi, Madi, Medha. First screening is done. Medha and Prajna screening is done. After screening, with the help of elaborated questionnaire, we wanted to expand whichever thing among the 5 elements where the problem exists. Okay. Then next thing is secondary goal setting. Uh, Here the goal is stated like based on the awareness you have gained through our discussion, what change would you like to see within yourself that could help you feel happier, more comfortable and healthier? Okay, this is the secondary goal. This is the Vijnana. Jnana already we discussed. Vijnana is nothing other than the goal setting. Now, Dhairya is introduced in between because Dhairya is actually the deep relaxation aspect of Dhairya is utilized here. Here you can see how Dhairya is done, like introduction, then the procedure of Dhairya is given, seating and preparation. Like if till the this portion, the client can be sit in the normal seats and all. here from this point onwards, the sitting should be in a semi-sleeper couch or something like a recliner and all. Okay. If from the very beginning, if the person is asked to sit in a recliner posture, it will be very uncomfortable. The person want to lie down in front of us, and it will be very uncomfortable to the client. So after having a good rapport, after doing the ACT, the client will be easy to go to that recliner position and all. Okay. Then seating and preparation, awareness of surroundings. What we do in our regular practice, body awareness, progressive muscle relaxation like body scan, and deepening mental calmness. Then bringing the goal back to the mind. Here, detailed notes are given for doctors. And the very important thing is that for doing Dhairya, detailed script is given. How we can start the Dhairya process. Like, please sit comfortably from the first statement till the end. How we can do the body scanning, first sitting posture, then awareness about the surroundings, then deeply bring the awareness about the body, like body scanning. Like the detailed steps are given. Uh, it's elaborated in this head. Then last, you can see that bringing the goal. Now, in this calm state, gently bring your mind the goal. So from here, again, the goal is brought back to mind, and it is led to the next phase, which is Smriti meditation therapy. Actually, Dhairya is a bridging part between the ACT and Smriti meditation therapy. SMT, first and foremost thing is induction method. Induction is explained in detail, like natural images, kinesthetic, emotional, recall, how it is being done. All these things are explained in the induction technique. Okay. Next thing is uh, induction skills. While learning the Smriti course, the most challenging part is like after concluding the classes, most of you will be asking the question like, for this condition, what induction should be used? Which either the flower is good or the mountain is good, or we want to give some images like river, or which is apt for this condition. Like so many doubts are there regarding the induction, because induction is very important in bringing the person to deep swapna state. So till Dhairya, the person is before Dhairya, while conducting the ACT, the person is in a Jagrat phase. We are introducing Dhairya to bring the person from the Jagrat state to the Swapna state. So while stating the goal, once again, maybe the client will be logically thinking about the goal and all. Again, we want to bring the person back to the deeper Swapna state. For that, induction is very, very, very important. So the certain induction skills are explained, like preliminary trials with eye open. With eye open, we can see, yeah, that you can see that anjana, like what is happening to that anjana after seeing the goal. Changes happen as a result of the goal. What changes will be there happening, what positive changes will be happening. You can just visualize that girl, how the life will be. So the person will be is gradually moving to a swapna state. Then providing prior orientation, we can give before the session an idea about, yeah, after this dhairya after the deep relaxation, you will be led into a deeper phase of meditation. In that meditation, you will be getting some random images, and without any effort, that images will be very clear. The things will be like in a movie, watching a movie. That clarity will be there. You want to communicate with me. Like you can give a prior orientation about the induction, what is happening once the Swapna is introduced. Then voice modulation. Voice modulation is very important based on the state of Swapna. If it is at the beginning, how the voice modulation is done, how the articulation is word should be done, which word should be selected. Mostly, if the person is saying that, yeah, I can see the flower right now. Okay, now we can say like just feel this that the fragrance or uh, it's something like deepening inside. So if the person is feeling, yeah, I can feel that breathe. It's deeply inside. I can perceive the smell or like that. The word should be like pointing to deepen that things. So if the person is stating that, yeah, I'm feeling a heaviness in the chest, so we can give some comments like just get deeply inside the chest, and now you can see what is there inside the chest. What do you feel there? Because of the heaviness in the chest, what all are the uncomfortable feel that you are experiencing? So we are deepening. The words that use should be helping the client to deepen into the Swapna state. Voice modulation, flexibility with the induction method. We can use multiple induction techniques, starting from the images, from the kinesthetic feel, from the emotional aspects. We can integrate those things. While seeing the flower, what emotion do you feel? I am feeling so happy. So while feeling the happiness, just be aware of the changes in your body. So we are integrating visual, emotional, and kinesthetic. Like we can do in like we can integrate many induction techniques. Like then language selection, most appropriate language should be selected. And if in certain cases, if there is need of a translator, we should have such facility also. How we can we should arrange, we should have a plan while taking the language. Then managing external distraction, preventing sleeping sleep during induction is here. Many methods are given, like increasing the frequency of interaction, allowing a short nap with prior suggestion that the client will awaken refreshed, interrupting the session, engaging brief conversation, and we can ask the client just open the eyes and we can have a short conversation and once again bring to the Swapna state. Then non-cooperation due to unwillingness, how it should be attended. Then the next thing is Ashta Smriti guidance. So after doing the induction, the person will be led to a deeper Swapna state. Now the Swapna state should be continued. The most important phase of meditation is sustaining the Swapna state. We can lead the client to Swapna state, and after seeing the flower and all, at some point, the person may say, "Oh, I know, no, I can't see anything now. Just like the darkness, what after closing my eyes, oh, that's what I am perceiving." The client may state something like that. So after entering to the Swapna state, sustaining the Swapna state is the most important part. For that, we wanted to use the Ashtasmriti guidance. It is nothing like the Nimitta, Rupa, Grahana, Sadasya. Those 8 things are mentioned for recollection of past memories, perception of cause, perception of form, Nimitta Grahana, Rupa Grahana, Sadrisya, similarity, Vipariya, contrast, enhancement of Sattva, Sattva Anubandha, repetition, Abhyasa, collective knowledge, Jnana Yoga, and repeated hearing, Punasruta. These are the 8 techniques utilized for recollecting past memories or Ashtasmriti techniques. Now the tips for providing guiding clients into deeper Swapna is given. provide reflection of experiences, like encourage client to express emerging feelings, thoughts, and actions, frame reflection statements to resonate deeply and strengthen awareness. Once the person start to share uh, his or her experience, we can reflect that things that is included in the reflection of experience. Work with dissociated ego state. We can see when that memory is coming. If the client is seeing that the client is like 32-year-old, now the client is seeing her past childhood state. Now we can ask, okay, when that 32-year-old Anjana sees that 5-year-old girl, what do you feel? Like we can dissociate the person. Or at one phase also, we can say, ask the person like, okay, now you can see your mirror image. How do you look like? What changes are being happening on your face, in your appearance, in your way of response? Like we can split the person to different ego state. Then facilitate witnessing of the self, guide like a third person, just analyze the thoughts, emotions, like an observer. The person is seeing himself or herself as a third person and analyzing the self. Then engage with the internal world. That encourage the client to step into the scene and live it. That means the person is asked to re-experience that thing. Either maybe a live experience, or it can be a past experience also. Then normalize and embrace discomfort. Discomfort will be there always, and discomfort is the most important part that should happen during the session, because the distractions are giving more new insight. If there is no new distractions, means it will be like a normal guided meditation. The person will be always feeling that high feels only. The person is not attending the problems. If the client is attending the problems, is there will be obviously uncomfortable feels. So we want to encourage the client. It's okay to have that unpleasant feel. Just be aware what is happening. We want to normalize and embrace. We want to encourage it. Then expand body perceptions, like right half, left half, upper half, lower half. Like we can split the body half. If the head is getting relaxed, then we can ask the client, okay, now you can see your body, seeing from the head what all are the changes happening in the body. So that person will be having a different view, sitting in a comfortable space like their relaxed head, and seeing the uncomfortable other parts of the body. Then observe the inner silence. Let the person experience some calm state or silent state. Let person experience. We should give ample time. We should not interfere in between. If the person is in a deep, calm, silent, relaxed state, give time, give adequate time. It will be helping to solve the problem. Then foster trust and safety. uh, if the session is going through very uncomfortable feeling, we can ask the client. Maybe sometimes a person will be unbearable with the emotional or physical feelings that the person perceives. Then we can ask the person to just open eyes, and we can have a short conversation. We can give some trust the person. Nothing will happen. I will be there always to help you. Don't worry about. Like we can give some trust to the person, and we can continue the session. Then the levels of Swapna consciousness. Swapna is further divided into different levels, like uh, starting from the Jagrat, the launch pad phase, then Swapna stage 1, Swapna stage 2, Swapna stage 3, Swapna orbit. You can read the details from the SOP. so that you should have an idea. Swapna is having different level. So in the first level, like just enter into the Swapna state from the Jagrat, it will be, the person will be it will be easily reversible. The person can come back to the Jagrat phase very easily. And once the Swapna is in that third or fourth or final Swapna orbital phase, the person will be having that deep sensational feels and all. Okay. Now, a successful Smriti meditation session, uh, all these stages should be undergone. Like smooth induction should be there, collective experiences, overcoming the barriers, entering to Sushupti, and transcending to Turiya. This is the ultimate successful session. Then it's given like state of Sushupti, what all are the things happening in Sushupti, what are the characteristics of Sushupti, then the state of Turiya, what is the outcome if the person is able to reach the Turiya phase, what are the features of Turiya. Then after reaching the Turiya, or if the person is not able to reach that Turiya, the meditation, sometimes the meditation will be up to the level of Sushupti only. And in certain cases, the meditations will be up to the Swapna level only. Anyway, after completing the process, we want to bring back to the Jagrat phase. So, returning to Jagrat phase is very important. How we should return to Jagrat phase? This is a part of conclusion of the session. Emerging from meditative phase, doctor generally guides the client back to Jagrat, asking the client to deepen the breathing, encouraging awareness of physical sensation in the body. Client is encouraged to share what they saw, felt, or experienced, understood on the basis of, then we can ask the what about the realization or understanding that the client had from the session. Then after connecting the insight, so based on the insight, what all the practical steps you want to make in your daily life, you can ask the questions like that. It will be making like a reinforcement of what the person had realized, what revelation he had from the session, slowly inviting them to open their eyes, like rub your palms, may wipe your face, and can slowly open your eyes. Come back to normal Jagrat phase. Then after that, a short dialogue ensures that realizations are anchored uh, to the normal practical life. Okay. Then factors affecting the outcome, client related factors, doctor related factors. It is explained like that. Then external factors. Then you can read all these things. Then handling premature or incomplete session. This is very important. At sometimes we will not be able to complete the session in a proper way. So at this time, how we should handle the session? Find a positive note, avoid disappointment. Both the practitioner and client both should not be disappointed. Always we have a tendency to be disappointed if we won't get a proper result, because we are investing like 1 to 2 hours for a client, and if we are getting not that desirable outcome, means it will be definitely there is a point of disappointment. But it is not the right way. Avoid disappointment, encourage the client, and in every failed session also there will be certain insight. Based on the session, you can have a conversation with the client. You want to motivate the client, and um, you want to encourage the client to take the follow-up sessions. Okay. Then follow up after an SNT session. We already discussed this 3 to 5 session, how the flexibility is done for uh, flexibility of scheduling the session is done. Now it is a conclusion. Now coming to the appendices. First part is patient information. This is just a model. Smriti Ayurveda Meditation Therapy, Smriti Institute. address, all these things given. Helpline is number is given. Then about Smriti meditation, short, brief explanation is given. Your right as client, your responsibilities, appointment procedures, fees and payments. I already told you it's better to incur a uh, prior charge to conclude to confirm the appointment, to avoid the cancellation and all. Confidentiality and record management, communication and feedback, referral and additional care. Then for online SAMT sessions, safety protocols are additionally added. Presence of an assisting person, because the client is not with you. So if any adverse things happens before the starting the session, you want to collect the details of another person who is near to the client. Purpose: this ensure safety in case of you experience emotional overwhelm, you face sudden physical discomfort, internal disruptions, or it may happen at many cases. Like the person is will be in that meditative phase, connection will be gone, person will be continuing for long time. In your practical sessions, often it happened, isn't it? So at this time, we want to have a at least a bystander, not bystander, another person's number should be with us. Then acknowledgement. Appendix 2 is consent form for Smriti Ayurveda meditation therapy. Here also you can see the consent form, purpose of therapy, procedure, benefits, possible discomfort, confidentiality, voluntary participation, fees and payment, special consent for online SAMT session, then declaration of consent, client detail, all these things are included. Then the third thing is the screening, preliminary screening and registration form, basic demographic details, then referral and background, how the client is getting your details. Have you previously taken counseling, like previous details are recorded. Then presenting problem. Then we will get an idea before starting the session if these details are collected. Physical symptom, medical and psychological history, uh, online session safety conduct details if the sessions are conducted online. Then section 6 is goal setting. Initial screening outcome. You can see whether the client is suitable for SMT or needs medical management or referral. Or you can see if it is not suitable, you can mark not suitable at present. Then section 7, consent and declaration form. So these are the things included in the SOP. I know it's a very fast and I have explained in minimal words. You will be having a lot of confusions. We will share the document. You can learn it. And before that, if you have some queries, sir is with us. You can ask your queries. Before that, I'm just handing over to the session to Dilip sir.
Thank you, Dr. Safir, for that detailed information about SOP. And of course, as he mentioned that you may be having some doubts or need some more clarifications, you can ask. I hope Dr. Safir himself will be answering. And of course, if it is needed, I will be interfering. He is ready to answer, address your questions, please.
I think there is a starting trouble. And Raisha doctor is ready to ask some question. I think she is trying to ask something. No.
നമസ്കാരം സർ, ഞാൻ ഡോക്ടർ ദീപ തൃപ്പൂണിത്തുറയിൽ.
Yes, please.
Yeah, a small doubt. After completing the Smriti session, the patient is again sitting and talking for 1 more hour, and the patient is again willing to talk for more than 1 hour. So how can we make the patient go? Is my doubt. They are ready to pay, but after finishing the session, that is this meditation session.
Okay. Actually, before starting the session itself, we should give a clarity about the timing and all, so that the session will be from, if it is starting at 8 a.m., we will give the details at from 8 a.m. to 10 a.m. or like how it's usually here 90 minutes to 120 minutes is mentioned. Maybe it may vary in certain cases. Usually, in my case, at least 2 hours I am spending. Most of the cases, at least 2 hours I am spending. So, we'll give a clarity that initially the time is like we wanted to start the session on time. So, you should meet on time. We will start the session on right time. And in very rarely, in certain cases, the meditative part will be in an unsettled phase, and the person will be needed more time to settle uh, that rigorous emotional pain and all. So at that time, we will give some additional time and we will conclude the session. And after that, we will ask the client, okay, now it is I already explained in the SOP how the session is concluded. And after concluding, we can ask the client like, now we can meet on this day. You can give an appointment to the next session based checking on your appointment details. So we will be meeting after. Usually, this next session is done on the third day. So it is on 15th, coming 15th, morning 8 a.m. is available. You can come on 15th morning. Like you can give a clarity, and you should have a good professional communication with the client. And it is ideal to have a administrative front office, something like that, and that person may help us to have proper communication, like how the time is scheduled and like that. So we should have a very clear professional approach. Otherwise, the patient will be having a lot of things to share about the person's family or about kids or whatever things he is going through, or many things will be there. In addition to the problem, what the person has discussed during the session. So we should not encourage that things. If the person is having uh, many things to share, means the person can take a prior appointment and do another session. That is the most professional way. Otherwise, what will happen? The next client will be waiting there. The 10 a.m. session client will be waiting there. Then that person will be getting frustrated. Okay, we should have a professional approach there. Okay. വളരെ ചെറിയ കുട്ടികൾ, ഒരു 5 to 6 year old ഉള്ള കുട്ടിക്ക് OCD സിംറ്റംസ് കാണിക്കുന്നു എങ്കിൽ നമുക്ക് എങ്ങനെ മാനേജ് ചെയ്യാം? So it's not very easy to manage kids generally who don't have a proper insight about the problem, or if the kid is not having that emotional maturity, it's not so easy to do the Smriti meditation. But in certain cases, the kid will be having good emotional maturity, even the kid is having a lesser age, then we can try meditation, no problem. Usually, in case of kids presenting with any psychological issues or psychosomatic illness, we should attend the kid as well as the kid's parents. Most often, the session will be needed to the parents. Last week, I had a kid who is studying in fifth or sixth standard, and there was a lot of complaints about the kid, about the scholastic disabilities and all. Actually, I started one session I had with the kid, and I understood something is there, some problem is there with the mother. Then later on, I have done 3 sessions for the mother. Actually, the problem was with the mother. Problem is there, obviously, with the kidneys also, with some problems are there. But the problem was, most of the problems were because of the anxious interventions made by the mother. So once the mother has settled down, once the mother has realized, the thing was that the mom had a lot of insecurities regarding her school days, because during her school days she had suffered a lot of bullying because of low marks, and because of poor academic performance. She got scolded from her parents. She was not able to face her family members. A lot of things happened. So the mother was very particular that my child should never suffer from all these things. So to make this child best in the academics, that was the prime motive of the mother. So she was pushing the child was like anything, and the child was suffering from all these pressures. So once the mother realized her problem, he started. Actually, she had a lot of complaints like gastric issues were there, like gastritis, insomnia was there. She was not able to focus on her career. Later, what happened? She uh, changed her focus from the kid to her life. She got good sleep. Her gastric complaints relieved. She is more into her professional life, and she is very satisfied now. Kidney is not totally cured because some scholastic issues are still there. It should be corrected. So whenever the problem is projected in child, we should attend the mother or the immediately affecting parent, either the mother or the father or both. Okay, this is the way how we want to handle kids under 10 years. Okay. Can we go for a group meditation on daily basis for about 1 month, like that? How can we plan this? Definitely, we can go for group meditation therapy. Make sure that if it's based on a problem, make sure that at least the problem is or having a common nature. So it's based on fear or phobia. It's a group of persons with basic emotional distress happening from fear or phobia is there. Then we can, it's a kind of homogeneous group. So we can give Smriti session more effectively. So if it's a very heterogeneous group, like one person is having schizophrenia, other person is perfectly healthy being, it will be very uncomfortable to continue the session for a prolonged period like 1 month. And so the persons having a common problem, if we are grouping like that, it will be more effective The other thing will be also effective, but the effect will be more if the persons, the group, the particular participants are having a common problem. And we have conducted successfully this group meditation therapy, particularly in cases like anxiety, fear, phobia, that spectrum of diseases, and it worked out well. We have a good experience in conducting that it was not only meditative session. Apart from that, ACT was also there. For each participant, we have conducted ACT, then group meditation, and we have given some orientation classes also, because corrections in Vidya should also be addressed. We can easily address by conducting certain educative classes to psychoeducation classes, like in case of fear and all, what is the basic cause of fear, how it is affecting the people, what all are the complications like phobia or panic attack or anxiety, what all are the reflections of the basic emotion fear, how it is affecting physically, like in case of panic attack, gastric issues like irritable bowel syndrome and all. Like we can give particular psychoeducation classes based on our Smriti experiences to this common group. I think it's clear, Dr. Anisha. Okay.
Good evening, sir.
Yeah, please.
Sir, actually, I want to take a recommendation from you, like whether any other platform other than Google Meet or Zoom can be used for online sessions, like anything better that can be used.
Okay. Practically, we use Google Meet and Zoom for practices, and we have one team with us. One more organization is with us. One technical team is collaborating with us. They are providing their own platform. It is known as Be Light, Be Real, a separate startup, private limited company associating with Smriti Institute. So they are providing Smriti sessions, and you can utilize their platform also. If you are interested, they will be charging some platform fee and all. There is a very systematic method of intake, starting from the intake, reminders on regular basis. A meeting link will be sent to the person, and reminders will be getting to the doctor also. Like it's a very systematically organized platform exclusively for Smriti practitioners. Nothing other than Smriti practice is being encouraged by that team. Okay, you can contact with them. Okay.
Thank you, sir.
Okay, thank you.
So there is a question in chat box. If the parents are not willing to take session, can we give 100% result only by giving session to child only in study pressure given by parents?
It's not so easy, because often the kids will be not having that emotional freedom like an adult to make decisions or to change behaviors. Often the child will be under parental control. So the parent should also have an awareness about what the kid is going through and why the parent is so particular about getting good mark or that academic excellence or whatever thing. So it's better to do the Smriti practitioners to that mother also. It will be ideal. It will yield good result. Otherwise, in many cases, like what I told about one case I attended, that kid was not at all interested to take the session. We can't blame the kid because he is having not that emotional maturity and all. In between he shows many distractions and all, and the kid is not able to attend consecutive sessions. So in that case, we are totally helpless when only kid is available. We have to focus on the mother itself. Then only the problem will be solved. If the parent wants to sit with us during therapy and child wants a private session, what should be done? 15. Never allow parent in the therapy room. Before that, we can have a conversation, short conversation. Okay, you can have your own statement about your kid. I will hear, I will listen to that part. After that, while starting the conversation with the kid, the parent should be kept apart. Okay, and can Yama and Niyama included in ACT or before ACT? Actually, Yama and Niyama are included as a part of Dhairya therapy. Dhairya is usually practiced after ACT or SMT. So once the like in case of um, uh, like antisocial behavior or what kind of destructive patterns or personality disorders like borderline personality disorder and all. If the person want to practice non-violent communication, it is nothing other than yama. How to practice yama? It should the person should be educated. The client should be educated to practice yama after ACT and SMT. So at one point before ACT and SMT, if you are going to educate the client will be totally reluctant to accept those things, isn't it? So he will be getting all those advices from everywhere. If you are again starting to advise the person to practice non-violence and all, what is the point in advising that? So before that, you have to make sure what emotional issues are leading the person to behave like this, how the behavioral pattern is evolved in the person. So what emotional aspects are there to be addressed? What kind of thought patterns are there that leading to this particular behavioral pattern? It should be addressed. It should be cleared. Then the person should be educated to practice yama and niyama. Okay. Is it clear, Dr. Saraswati? No, Dr. Meera, I think, yama and niyama. Dr. Meera, is it clear?
Yes, sir, it is clear. My doubt was for simple like aparigraha, or maybe he is not very what you say calm, or he is not well disciplined in his life.
Okay,
So
okay.
my question was not about ahimsa, but shaucha or simple things in life, whether it should be included before the ACT, during if it is a physical illness, that might be this yama. Mm.
Okay, okay. 1 minute. I will ask the first part also. I thought that question was the second part of what Dr. Saraswati asked. One thing is daily Smriti meditation for oneself different from dhyana in Ashtanga yoga, or as it the same? If different, how to do? So doubt is about the induction part. Could you please ask that doubt regarding induction means what clarity do you want to have?
Sir, in dhyana, in Ashtanga Yoga, how we do is self-awareness, and then meditation. But in Smriti, do we have to concentrate in a point which we have a discomfort? Do we have to think about the some issues in our life, or what should be in Smriti meditation? How like we should do like a induction with no one to give an induction. So how we should
The
start it?
most important difference between a regular Ashtanga yoga meditation and Smriti meditation practice is Smriti meditation practice is always goal oriented. we should have a goal before starting the session. Okay, this is my problem and I want to attend this problem. If there is no problem, it should be in a positive aspect also. It's like I want to do one challenging situation today. I want to face an audience and a crowded audience, and I want to present my paper or something like that. So if it can be in a positive aspect, like we want to achieve something, or we want to solve some problems. Anyway, we should have a goal for doing Smriti meditation practice. Okay. So we already described it's a Sattva Vijaya Chikitsa and all. The Sattva Vijaya Chikitsa mean elevation of Sattva is having immense possibilities. There is no need to have a particular problem. There we can have something we can achieve higher goals also. Like I want to upgrade my practice. Now I am getting income, like for example, now I am getting per month I am getting 100 sessions. I want to upgrade my practice to get 150 sessions in coming 6 months. It's a goal. We can meditate on that part also. So what is the hurdle in upgrading my clinical practice? So we can have a clarity. Oh, these and these things are blocking my skills or my strength. I want to focus on this part. So we can have a uh, positive goals in Smriti. Also, we can have negative part also. I had a conflict with my partner. So I want to have a clarity about what made me so frustrated when I was talking with my partner. So I want to sit and I want to analyze in depth. That is problem solving mode of Smriti meditation. So anywhere when Smriti meditation is being practiced, it should be goal oriented. In Ashtanga Yoga practice, we don't want to have particular goal. We want simply do that pratyahara, dharana, dhyana, samadhi, all these things. Okay. And the second part is like while doing aparigraha, if it's also like the non-violent communication what I discussed earlier. The person will be getting a lot of advices from many part, but the person will not be able to change the habit. The habit of not being cleanly, maybe because of some emotional aspects. There will be some underlying emotional problems. We want to first address that part. If the person is in the moderate or severe depressed phase, obviously the person will not be able to maintain a good hygiene and all. So first we have to correct that depressive episodes, depressive mood. Once the depressive mood is corrected, then the person itself will be having a clarity that now I don't keep my hygiene in a proper way. I don't make sure that I take bath. I do wear good dressing and all. In all this aspect, I have problems. So I wanted to correct. After the session itself, the person will be getting some clarity. Okay. So always do ACT and SMT and then discuss about the yama and niyama. Sometimes the person itself will get a clarity about the yama and niyama or whatever things, or else we should have a discussion about, yeah, you realize these things. So how do you want to execute these things in your life? We can have a discussion and we can give, if something from our part like psychoeducation or like what something we want to educate the person, we can also give that part also. It should be only after the ACT and SMT and after getting proper realization about the problem. This is the ideal practice. Okay. If
Hello,
there is
sir.
uh,
Sir, I have small doubt.
okay.
So this is regarding the case which we were actually discussing. So sir was guiding me in one of the patient's case, right? So actually, the patient, whenever I gave the induction method, she very quickly she enters into the meditation phase. But then once what happened was she was having body shiverings during the meditation. So that was part of the meditation. She was actually following the right path. Everything was okay. But then suddenly she had asked me that can you see my shivering? So I didn't expect such a question because when somebody is in meditation, so we don't expect such a question, right? So is that normal or
Okay. Uh, so in certain cases where the person is going through very adverse feelings or experiences, either emotional or physical experiences, the person may be having a tendency to come back to the Jagrut state. Even though the person was in deep meditative phase, the person may come back to the Jagrut phase and she can interrogate like whether you're seeing my shivering or see I'm going through very uncomfortable, very these kind of feelings. Like the person can interrogate with the person who can ask the gate. So what I want to do like that questions. If the situation is not at all tolerable, we can just ask the client to open the eyes. We can have a short discussion about what the person felt, what was the experience she or he has gone through, emotionally, what she felt when that shivering happened. And especially in certain cases, like maybe regarding past memories and all, at any time previously you had such an experience, like we can have a conversation. Maybe if the person is saying that, yeah, I had the same experience 5 years back when my kid was very young and my partner was shouting at me in front of the kid, like that a particular situation will be there. Then it is very easy to get back to that particular memory and we can solve that emotion very easily.
okay?
So that kind of things happen, and in certain cases, like person may say like I can't see anything. I am just listening your words. I can see the sound of fan. Like it may come back to Jagrat. Then also we can just ask the client to open eyes and have a small conversation, and we can lead to further Supna and all. And very rarely. Earlier, we had a lot of cases where the meditation was not that easy. But after having a lot of practices, now we are almost confident that in almost every person, if the person, even though the person is reluctant initially also, we can bring the person to the Swapna state. Very rarely we are getting failed. So it's after our long experience, like in every aspect, we have certain tools. The SOP is primarily intended to have a clarity about how to handle cases. So if the person is distracted, how to handle the case, we want to have an idea. Okay. So it's very clearly mentioned there. If the person is coming back to Jagrat's phase, what should be done? If it is a premature meditation, what should be done? If the meditation fails, what should be done? So it's very clearly mentioned all those particular scenarios in the SOP. So like Sir told, SOP should be like, you should read it like a Bible of SOP. You should keep it like that. Okay, now
Okay, thank you, sir.
I think it's late, and thank you all for your patient listening. Thank you, and once again I am handing over to Dilip sir. Over to you, sir.
Okay, fine, very good. I think we were asking very important questions, and Dr. Safir was able to answer almost all the questions. But as we mentioned that the process will be continuing because we are trying to improvise the practice from experience of different participants, different doctors, and from patients. We are gathering a lot of information and trying to improvise. But our very important goal is that when we go further forward, this uniformity needs to be maintained. If a person is doing a Smriti meditation anywhere in the world, it should be in accordance with the criteria which we have developed. Because there is a tendency that some doctors used to add many more other things and manipulate according to their convenience. So our humble request is not that we need not to deviate much from that basic concept. Of course, situational modification is quite needed. That is agreeable. But we are strongly following Sattva treatment of Ayurveda, Charaka Samhita. So, but all the minute aspects we are considering from other experience and practice also. But we need to maintain this identity as a Ayurvedic Sattva Chikitsa, so that we should not deviate much from the basic concepts. Because it to be explored a lot of information from our classical text. We are trying to do that. That is why, as we mentioned, we have conducting some research work on this in collaboration with Ayurveda colleges and such institutions. So whenever it is available for you for us to share with you, we'll be back here to share with you. Everything is open to you, and please cooperate with us for doing this work. So once again, I would like to thank all of you for such wonderful queries and patient listening for that. I would like to ask Dr. Veena to say a word of thanks.
Thank you, sir. Good evening, all. It is my privilege to propose a heartfelt vote of thanks for Smriti Vaibhavam, event organized by Smriti Meditation Research Institute for Therapeutic Innovations. We extended our sincere gratitude to the chairman of Smriti Institute, Dr. K.V. Dilip Kumar, for graciously moderating this monthly gathering of Smriti practitioners. Our deepest appreciation goes to Dr. M.V. Vinod Kumar, professor at VPSV Ayurveda College, Kottakkal, for releasing the significant book, Smriti Ayurveda Meditation Therapy Standard Operating Procedure. We also thank Dr. P.I. Muhammad Safir, Administrative Officer, Smriti, for delivering an insightful technical section on SOP orientation for Smriti practitioners. Last but not least, thank you to all the participants for making this a wonderful event. Thank you all.
Okay, thank you. So the SOP copy will be available to you. Martina, that will ensure that it will be available to you. And of course, we are also preparing a hard copy. We will inform you how to receive that hard copy. We will intimate you, but software copy will be immediately shared with you all. Okay, thank you. Bye.
Thank